Sir, first suture get. How was your experience?
Oh, it's fantastic. Seeing the all 360-degree angle getting ripped and all 360 tracheotomy done, I think is as good as your first topical phaco.
Super, sir.
It was a pleasure to learn from you about the GAT, which you have a lot of experience from, and you are all teaching experience and that also. So I think I'll carry this forward and try to give myself a better glaucoma person and incorporate all MIGS, MIGS in my day-to-day practice.
Theoretically also is good, practically also good number of patients. We can follow up these patients in the evening at the evening ward rounds. Everything is perfect for this, for the small customized training, which I feel now is not available also at many places. And we cannot give more than that time also, yes, for someone who is a busy practitioner. So very customizable. No, it's a very nice guidance. See, he guides very thoroughly, basic from A to Z. So from beginning to everything, all small issues that can crop up in the MIGS to everything. Quite a good amount of video collection. So video assisted skill transfer is a strength, I guess, in this curriculum. He gives a good amount of time to explain all the small details about any surgery before going into the OT and trying to execute it. So I think that video assisted sessions, they are the backbone, I guess, whole teaching programs. Yes. The curriculum is very nicely designed from first step, the temporally sitting and then doing the intra gonioscopy. Those who are superior phaco surgeons, they might find a challenge. Someone who is doing a temporal phaco, I think for them it's easy. Another important thing is about learning the XYZ axis microscope movement, because with the left leg you need to manage the microscope, zoom in, zoom out, fine focus. So all that we need to learn. So everything from basic intragonioscopy, bang, KDB, eye stent to all the preparations of GAT surgeries, making the sutures, everything. So I think all that very nicely designed curriculum, and it covers all the MIGS aspects. And I think whatever confidence we gain in those training, I think we should follow it once we go back to our setup. Yes. I got in touch with Dr. Prasanna Venkatesh and few of the admin people, and the process was quite smooth. Then I decided my dates, and then I could plan my trip. Yes. But I think getting a hang of eye stent, some of the nitty-gritties, and especially the GAT, how to make a suture, mushroom and everything, how to pass it on, how to find a resistance in the Schlemm's canal, what should be the plan B's. So I think he very nicely explains. So if someone is not doing a GAT or want to start the GAT, I think this is what I'll definitely recommend, because not many courses are available like this anywhere, and which can be customizable 1 day, 2 days, 3 days, as per whatever you want. So all the instruments, the cauteries, thermal cautery which you want, and not a wet cauteries. So all small details, we can know, which we don't get in the conference and other things and all. So fantastic course. I think now I learned from all the KDB to bang to eye stent, ECP, and then the GAT, suture GAT. So I got to learn all the aspects. I think 10-12 cases which I observed and saw and did some few baby steps. I think I'll have a lot of can-do confidence. I think that's where I will build on over next 6 months to 1 year. Thanks to Prasanna.